This is a paid program. JJ Publicidad, EMR, and its owners and associates take no responsibility for the opinions or statements made by the talk show host or their guest.
Ang buhay, buhay, buhay sa Amerika. Mabubuhay ka sa Amerika kahit mahirap ka ha. Basta't kasama mo, kababayan mo, maligaya ka na dito sa Amerika. Sa buhay-buhay sa Amerika.
Uy mga kababayan, kapuso at kapamilya, oras na para magsama-sama tayo para sa isang oras na kwentuhan na magbibigay ng aral at inspirasyon. Dito lang sa ating programang Buhay-Buhay sa Amerika ni Rhia Luz.
Hello mga kababayan, magandang hapon po sa inyong lahat. This is Rhia Luz, live at Entre Mujeres Radio for our Buhay-Buhay sa Amerika's episode, Varicose Veins, not just a cosmetic problem. And I am so blessed to be surrounded by amazing women right in front of me. And I have them as my co-hosts. And right next to me is the President-elect of Philippine Nurses Association of Arizona and the CEO and founder of My True Joy, Miss Rizza Ditchella.
Yes.
Hi Rizza, greet
Hi,
our
Rhia.
audience.
Yeah. Hello everybody. Magandang hapon, Pilipinas,
Yes.
America. Good morning, Philippines.
And India.
In India.
Yeah.
And India also. And it's hi, Dr. Meka.
Hi,
Annie. And it's nice to be back here at Buhay-Buhay sa Amerika.
Yes,
Yeah.
it was just last time you were our guest and
Yes.
now you're my co-host.
Yes, yes,
And
that's
next to
true.
you is another amazing and accomplished nurse in the Valley, the Vice President of Philippine Nurses Association of Arizona, and also a nurse manager of orthopedic surgery, the chair of Asian Connection Diversity of Mayo Clinic of Arizona. Please welcome Miss Annie Molina Manuel.
Thank you, Rizza. Thank you, everyone. This is my first time here. I'm very excited to be here and to meet Dr. Meka again.
Get close.
And to, of course, have Rizza with me, being co-host with Rhia. And thank you for the invitation. I'm so happy to be here. Thank you.
Yes, thank you so much for taking your very precious time away from work and being with us. And of course, this story would not happen without our special guest today. And this special guest is, I have known her, I work with her, and so I really would recommend this amazing Dr. Madhabi Meka. She is a double board certified on vascular medicine and vascular surgery. She has received multiple awards for her work in the field of vascular surgery. Let's welcome our vascular surgeon, founder and CEO of Apex Vein and Vascular Institute, Dr. Madhabi Meka. Dr.
Thank
Meka.
you, Rhia. Thank you, Rizza and Annie, for being here. I'm surrounded by some beautiful, intelligent people. Hopefully, I can
Yes.
keep up with their questions today.
Oh, definitely. It's all within your expertise, Doc. And going back to what is our topic today, varicose veins, not just a cosmetic problem. That's what everybody think. Well, it's just a vein that is bulging in your leg, right? That's why I never wear shorts, because I have a huge varicose veins. And it all happened that I came to work with Dr. Meka. So how wonderful doctor she is with the coworker, with the patient. So I felt this is the person I can go to with my problem, because I happen to have pain on my varicose veins. That's the only time I seek for doctor's treatment. So I am very pleased that Dr. Meka has treated me, and that's why we brought her on the show, because I'm not alone on this issue.
That's right.
That's true. So the varicose vein problem affects about 30 million Americans, and about 2 million seek treatment, and that's quite unfortunate. It's 10 times more common than having arterial disease in the legs. And like Rhia said, most people dismiss it as a cosmetic problem, but there are a lot of implications on this, lot of lifestyle issues that come in. Patients ignore them and they move on to having complications eventually, and there is a risk of limb loss as well.
Wow, limb loss.
Wow.
That's
so what happened if these varicose veins are not being treated?
So varicose veins are just the tip of the iceberg of a venous insufficiency that's building inside your legs, in the leg veins. And these are just a telltale signs, a warning from your body telling you this is something that needs to be looked up by the doctor. And if this is ignored and we don't do anything to prevent the progression, eventually it can lead to forming skin changes, inflammation in the leg, not just the symptoms, but eventually it can lead to ulcerations, which can be really hard to heal.
Wow, that's
scary.
really difficult and scary. So what are the treatment options for varicose veins, doctor?
So most important thing is understanding why these actually develop, and the treatment will be based on what we think is the risk factors this patient has had in developing the varicose veins. So the most common ones are weight gain, having any blood clots in the legs, and lifestyle issues like we are in jobs where we have to sit or stand for a long period, pregnancy with the weight of the fetus pushing on these veins, and also the hormonal changes during pregnancy. And just with time, as people age, we have been fighting gravity. Our valves in the veins are fighting gravity for such a long time. They just give in, and eventually the vein walls become weak, the valves become damaged, and the blood just starts pooling in the legs.
And does diabetes add to it, doc?
To some extent, yeah, it can really cause the inflammation to progress. So the treatment will be really tailored towards the patient's needs as to the risk factors. And the most important thing with all of this is activity, and compression stockings would really help. And it's hard to wear them in summer in Arizona particularly, but having at least a light compression helps a lot. And most commonly, once you have already seen varicose veins are there in the legs, then the recommendation is to wear 20 to 30 millimeter of mercury compression.
20 to 30.
And lifestyle changes like taking short breaks to walk during the day, keeping your legs up when you're resting, and trying to be hydrated, which is one other thing. They can really add to preventing the progression of these veins.
Wow.
So you just mentioned that the way I understand it, like old age can be a factor, to have varicose veins as well. Does it have something to do also with genetic or familial
So it
tendency?
can, yeah, absolutely. It can run in the families, although there is no proven gene that goes well with it. But just like high blood pressure tends to happen in families, the venous pressure also can be high in some families. Part of it could be related to the obesity that might run in the family, or just weakened walls. But definitely that's a factor, and if your parents have had it, there is a good chance you would have it too. And age in itself is a risk factor. About 60% of women above the age of 60 and 50% of men above the age of 60 have it.
Yeah,
So-
so that myth that it's only women has varicose veins is not true.
That's exactly right. Yeah, men have them too, and I think they brush off the symptoms a little bit more easily
Yeah.
than women do. So a lot of the
'Cause-
symptoms that come with these veins, people under-recognize them. We attribute it to other problems in the legs, like having any neuropathy, or sometimes more like an arthritis issue. They try to combine this with arterial issues, muscular issues, and the veins itself, people just think it's cosmetic, and the problems that are there with it, people associate them with other medical conditions they may have.
So,
oh yeah, go ahead.
before we keep asking Dr. Meka, let's invite also the audience to
great.
ask
Yeah.
their questions while we are here.
That's
and
right.
while Dr. Meka is on with us, you are invited to ask your questions. So send your questions on the comment below on Facebook and on YouTube at Entre Mujeres Radio and Buhay-Buhay sa Amerika. And if you know somebody who has problem with varicose veins, send them this information, because many of us are actually looking for the right person to take care of us when we have this varicose issue. And I think we got the right person in the house. So invite everybody to send this link of the show so Dr. Meka can answer your question while she's here. Thank you so much. Let's continue your question, Annie.
So you were mentioning, Dr. Meka, that some people probably just think this is normal after giving birth or after working so many hours standing up.
Yeah.
They notice this varicose veins, but perhaps in their mind this is normal, part of getting old. How would one get started with getting it checked?
So I would imagine everybody would have a primary care doctor, and most of them are quite knowledgeable about this entity. Again, there may be some misconception that this could be cosmetic, but the patients need to be aware of the symptoms. So the symptoms you would be concerned about or can associate with the vein issue is having heaviness in the legs. Heaviness that gets worse throughout the day, more so bad towards the end of the day when they feel like they're dragging their legs. And swelling in the legs, very typically happening right around the ankles. So if they find this swelling and heaviness, and the kind of pain associated with the veins is mostly in the calf. And the way we differentiate this with the arterial plane or blockages in the arteries is, with the arteries, the pain comes on when you are walking, but in the veins, it's mostly when you are stationary. So if you are sitting or standing for a long time and you start having this crampy calf pain and the heaviness and the swelling, it's pretty much a venous disease unless proven otherwise. And one other classic symptom is having night cramps. So when you're sleeping at night and you have this Charlie horse kind of pain in your calf, most people think, at least the Arizona residents are going to think they are dehydrated.
Correct.
Yeah.
And older folks who are on medicines that make them go to the bathroom a lot, urinate a lot, might think it's an electrolyte abnormality.
True.
Of course, these need to be checked, and once these are corrected, and if these symptoms are consistently there, then it pretty much means it's a venous disease. All this blood pooling in your legs by the end of the day stretches your nerves and gives you this crampy pain at night. A very classic symptom for varicose veins.
Okay.
And also, does smoking add to...
To some extent, the chemicals within the smoking, just like they can damage arteries, they can sometimes damage the vein walls, and they can certainly contribute to the hypertension, venous hypertension within the veins. The other factors seem to be much more outstanding on this, though, like weight, lifestyle, pregnancies, age, and sometimes having blood clots in the past in the leg veins can damage the valves, and the blood clot might have been resolved or treated by the doctors, but the valve damage can be permanent and lead to varicose veins.
Wow.
So varicose veins, speaking of lifestyle, does not only affect those who are like us, like nurses, but also those who are like sitting for hours in their...
Absolutely, yeah. And I think COVID has
desk.
got a lot to add to this problem
right.
now. Everybody tends to be in a desk job. And the more you sit, people might think, oh, yeah, I'm not standing. But sitting is equally bad. Sitting can cause stagnation of the blood as well. Because when the blood moves in the veins, it is a combination of the muscles contracting in your legs that pushes it up, along with a series of valves along the veins that are going to make sure the blood is only flowing in one direction, that is towards the heart. So if you are sitting in one place and the gravity is constantly working on these veins, trying to separate them, trying to make them blow downwards, then the blood is going to start pulling and damaging the valves. And there are other professions just like us, not just medical professions where they are sitting or standing for a long time.
Yes.
Like I have had some teachers recently who have come to me with advanced venous disease with ulcers in their legs. Very under-recognized problem there. people who are in the hotel business, restaurant business,
Yes.
catering,
Retails.
people who are like bartenders, musicians, and medical field definitely a big thing. We are all
Yes.
standing for a long time.
That's very true. And that's why many times we only take care of ourselves when it is already
Full blown.
full blown. And like myself, I only went when I have pain. But also one time when I was when my varicose veins were still small, I went to this clinic. It's a cosmetic spa that is professing that they can take care of my varicose veins. Would you recommend, if they are not board certified, to do such kind of treatment for varicose veins, doc?
Well, spas, particularly if it's not a physician or a nurse practitioner, they are ideally just working on their spider veins, dealing with the cosmetic part of it. But the spider veins are the branches of the vein that's lying underneath the skin called the saphenous vein. And just trying to pluck out the stems and leaves is not going to result in a good relief, because the trunk of this tree is going to bear more stems and branches, and it's a problem that's going to continue. And they may not be thinking about what else is inside. They're probably only looking at what's on the outside.
Okay.
And even in the physician community, there are a lot of physicians who are not vascular surgeons. They are qualified to do this procedures for on the bigger veins too, but they may not have the in-depth knowledge regarding some problems that coexist with the veins, and it may not be ideal to even treat these veins sometimes when there are some coexistent conditions.
So what do you think is what kind of surgical procedure, or is there any permanent treatment to varicose veins?
That's right, yeah. So for the veins, we have one set of arteries in the legs, but we have more than one set of veins. So that's the reason, even though our veins are bad, some of them are bad, the blood still makes it to the heart and back into the
Yes.
circulation. So it's the treatment, the main treatment, if they have failed wearing compression stockings and doing lifestyle changes like being active, elevating legs, and trying to do what we call foot pumps, which is compressing the calf and doing little flips at the ankle. If they have failed that and their symptoms are persistent, or they have developed any bleeding or ulcers from these veins, then the next treatment would be shutting off these veins. So the superficial veins, as I said, there are multiples of those, so it's okay to take them. Unless you have problems in your arteries too, because even a damaged vein like this can be used to do a bypass procedure in the legs. But for most of the people, we generally just ablate them, what the procedure is called, vein ablation, to close these veins. And there are several different ways to do it.
And I heard about this vein stripping, which
Yeah.
do you do that though?
So vein stripping has become more of a medieval procedure now. Nobody does that anymore.
Oh, wow.
Yeah, so I did that when I was in med school and maybe my early part of residency almost 20 years ago, where we used to put a catheter inside the vein and rip the vein out of the body. That was
Wow.
the real
Oh,
vein
ouch.
stripping procedure. It's done under anesthesia, of course. The
It's the
ulcers after-
recovery I'm thinking of.
There will be some recovery. There is sedation involved and may not be ideal for patients who cannot take anesthesia because of their heart and lung conditions. But the latest procedures are pretty sweet and short, and we ablate them in the office. It takes about 15 minutes or so. Pretty quick and no sedation involved. It's done with a little puncture wound in the legs. We numb up the area of the skin, put in a small catheter, and there are several different things we can do with the catheter. We can heat it, which is called a thermal ablation. You probably heard the term laser or radio frequency. That's what we do. And we could also inject glue into the catheter and glue the vein shut, just like the glue we use in the brain when there are aneurysms and bleeding. It's the same glue. And the most latest one is a foam injection into these veins through this catheter. The foam is going to disrupt the inner linings of the vein, pretty much all the procedures, they disrupt the vein wall from inside and irritate it in a way and make it clot and shut down. For the branches, though, once the trunk of the tree has been taken care of, then we could do sclerotherapy on the branches. And sometimes these branches can be big enough that we may have to do a phlebectomy procedure, which is not really stripping, it's just really disconnecting the small branches. And that's also an office-based procedure where we make very tiny nicks after numbing up the skin area and disconnect the vein and tie it off. It's also an office-based procedure.
So basically, this is like outpatient procedures.
It is outpatient, yeah. And I have patients that work in the convenience stores around close by or any other offices. They come during the lunch hour, get the procedure, and
Wow.
go. Yeah, so there is essentially no downtime. And now, is there any discomfort? Yeah, there is discomfort during the procedure. It's like going to the dentist. When they're numbing you up, you're going to have some discomfort. But once you're numb, it's done. So
Yeah, I can testify to that, doc, because I think that's what I
you had the blue procedure.
Yeah.
Yeah.
Oh,
So-
so an outpatient one.
Yeah,
then,
it was
huh?
an outpatient, and Dr. Meka's office right there, Apex Vein and Vascular Institute at 4550 East Bell Road, Unit 280, Phoenix, Arizona. And the number is 623-252-4495. I can testify I had been there and experienced what she said, and it was no downtime.
So
It
when
was just an easy treatment, and Dr. Meka is really very professional, very caring, and all the staff that came to take care of me are, I would say, exceptional.
Thank you so much
Yeah.
for those kind words.
Yeah.
So when you say no downtime, all right, let's say on my lunch break, I go to your clinic, get this done. I can go back to work standing as a nurse, or
You can go back to work. The only inconvenience is you're going to have a compression wrap. So if you wear loose trousers, you're good to go. That's pretty much it.
so you don't have to go home, elevate your feet above your heart for 24, 48 hours.
Not necessarily. So generally, we recommend patients be active after the procedure too.
Oh,
The reason
okay.
being, with the procedures, we are making the vein shut down by making clot within it. And sometimes the body goes into a clotting mode and wants to create more clot, and this extends into deep vein. So there is about a 3 to 5% risk of developing a blood clot in the deep vein. So, and that is minimized if you are actually not sitting
Okay.
too much or being
So
stationary.
you need to be moving.
And also, I may add, Doc, right after, there will be no pain, but you can't be wearing short because you'll have an hematoma on the side. So,
Bruising.
Yeah.
There'll be a little bit of bruising at
Yeah.
the access site, and it goes away in a couple of
Yeah.
weeks. But there are no stitches involved on the skin. It's just a puncture. It's like getting an IV, essentially.
Is the treatment plan different if a patient does not have any distal pulses?
Absolutely, yeah. So like I said, the concomitant conditions that are with this, that's something that really needs a vascular specialist to be seeing the patient, because sometimes the patient has both venous disease and arterial disease, and in that case we don't want to take the veins out of the leg, because even these damaged veins can act like conduits for bypasses around the arteries. And we want to make sure that the patient does not have any arterial disease, and we always check the pulses of the patient. If there is any question, we make sure to do an ultrasound to rule out any arterial problem first before we take the veins out. Very important in patients that come with ulcers, because the ulcers could be a combination of several different things.
Correct.
So I have one question
go ahead.
from the audience.
Oh,
that
wow.
sent
Great.
me. So this friend, it says there on the mid calf there is intermittent pain, but there's no redness and it's not hot to touch. Since you could see it, Doc, is this considered? This is how it looked like.
So just looking at it, I cannot absolutely say the pain is related to the vein, but I can see the patient does have venous insufficiency, because what's under the skin there is what we call telangiectasias, which are intermediate between spider veins and varicose veins. The nomenclature is really based on the size. So if the pain is coming when they are at rest for a long period, like sitting or standing, then we could associate it with the veins. Or if it is with walking, then we may have to rule out an artery disease. So the best thing is to see a doctor who can do an ultrasound on your legs, get a good exam first, and then ultrasound will determine if you have vein problems.
So we can recommend them to come to your clinic.
That would be great.
Yeah. Right there in Phoenix, in Bell Road. So contact 623-252-4495 or 602-535-0913. And
What
Call
insurance would
Dr.
you take, Dr. Meka?
Meka.
We take most commercial insurances, and we also take some Medicaid plans. And just for the awareness for the patients, this is a medically necessary procedure, so it is covered by insurances. Now, what kind of procedure you get? As I mentioned, there are 4 different procedures that we could do. The kind of procedure you get, unfortunately, to some extent is dictated by insurance. Some insurance plans cover some procedures and some don't. So, but everybody can get a procedure that is going to be helpful for them. So,
That's right.
Do you need a referral from the primary care?
well, it depends on the insurance plans too. A person with the PPO plan will not need a referral. Patients who are on HMO plans will need a referral.
So anybody can just like call.
They can call,
directly
yeah, and Medicare
your
patients just can
clinic.
call.
And you will
yeah.
check, right, the insurance?
We will absolutely check, make sure we are in the plan, which we are in most plans, and we also give the patients an upfront idea as to how much it can cost them for the initial visit, and what cost it would be later on would really depend on what we see on the ultrasound. So
And may
there
I
could be more than one vein that might need treatment sometimes.
Yeah.
And, yeah.
May I add, Doc, since I'm talking about myself as a patient, by experience, also we recommend that you keep the receipt of your compression stockings, because in the future your insurance may deny, why are you only asking for this now? So, but at least if you have made effort to take care of your varicose veins with TED hosts, those are easier for them to
Right.
pay for your treatment, right?
That's right. Yeah. So as I said, there is always a conservative management first. We recommend they wear 20 to 30 millimeter of mercury compression stockings and do some lifestyle modifications to see if the symptoms are better. And at the end of 3 months, we see the patient again to see how they're doing. And if they are doing well and their symptoms are controlled, then they would not need any surgical treatment. And not all patients would have significant improvement. And there are always going to be patients who have had ulcers, and they may not be ideal to continue to wait. So those patients will need treatment, that is closure of the veins.
For us nurses, you recommend the same, the 20 to 30?
Yeah, 20
or-
to 30 is the prescription strength, what we call. So that would really help. If you have seen a varicose vein on the skin, the 20 to 30 is great. Now, patients who have had treatments already, they may move on to wearing a lighter compression, like a 15 to 20. But compression would really be helpful pretty much all your life, if you can.
Correct. That's a very good pictures right there. Would you be able to share with us, Doc, about more on this
Yeah.
pictures?
So if you see after the normal veins, the first one there is very, very tiny veins, what we call the spider veins or the reticular veins. These are just the tip of the iceberg. They are telling you, hey, you are starting to have vein problem. Look at what you could do to not let it go on to the second stage. And at the second stage, the veins have become a lot more obvious. They are much larger. So once they start getting as large as 3 millimeters, we call them varicose veins. Now, if we let them be where they are without taking good care of the legs, not wearing the stockings or not doing anything else like leg elevations or exercise, then the pressure within the veins can get so much higher with time. The fluid from the veins is going to leak out because the vein walls are very, very thin. And that fluid is also going to cause significant inflammation and skin changes, skin thickening. And some part of it is really related to the iron deposition in the skin. The color that we see on those pictures, on the last 2 pictures, is what we call lipodermatosclerosis. That's a condition where the very, very tiny veins under the skin are rupturing because of the pressure. And most of the blood products get absorbed into the blood system, but the iron just gets deposited in the skin, giving permanent changes. And even if you had treated the patient's veins eventually, that skin changes may not go away completely. Most of them tend to have them forever. Now, if we just leave them be at this stage, then they move on to the skin thinning out to the extent that they start forming ulcers. Very classic ulcers are seen right at the ankle joint in the inner or outer part of the ankle, and that's a very classic area where these venous ulcers form.
And there are issues of bleeding with those varicose veins.
Absolutely. Yeah, I have had patients who have been to the ER. They just put compression and come to see me, and that's an emergency situation where we really want to depressurize the veins, and we want to shut off those veins where these tiny bleeders are coming from.
That's why vascular surgeons are very important.
Yeah.
we never would think that varicose veins would be a big issue,
A
but
vascular problem.
now listening to Dr. Meka,
That it is not a cosmetic problem.
It is not just a cosmetic
isn't, yeah.
issue. Yes.
So once we saw a little spider crawling on our legs, then we have to like make sure we like do things that can prevent it.
Yes.
Especially for us nurses.
That's
You know,
right.
we're very, very vulnerable to have varicose veins. We're one of those.
We take
that-
care of everybody except ourselves.
Yeah. And that's always the tendency. Right?
Yeah, trying to be active is very important. Sometimes we get so entangled in the patient care, we have to be in the same place, or a lot of charting involved. So we are pretty much stationary, but try to do some foot pumps when you're doing that. Try to move your foot up and down like you're pushing on the gas a few times every hour if you can. And try to walk when you get an opportunity to move out.
If you get an opportunity.
Yeah, I think we're walking a lot though as nurses,
Yeah, that
right?
you're standing up.
Yeah.
Now, you mentioned a lot of people since pandemic have started working from home, and of course sitting by the desk. And I've heard a lot of advice that you get a standing desk. Now, I have heard as well that standing all the time is also not good for you. So what would you say? What would you say is a good balance between sitting and standing? Let's say you have a choice of raising your desk to standing and then bringing it back to sitting. What would be a good balance between how long you should be sitting and how long you should be standing?
So both sitting and standing for long period is not great. So what you could do while sitting is at least one leg at a time. Try to keep the leg elevated on a stool next to you. So
Also.
elevate it so the heel is above the level of hip. So not like in a recliner, but you want the heel above the level of hip, so the blood drains back to the heart efficiently.
Okay.
And do some foot pumps. Standing makes it so much easier when you're standing to do some foot pumps. One leg at a time, lift it up and push the ankle up and down like you're pushing on the gas, and you want to feel that calf contract. That's going to help you move that blood up towards your heart.
Is that a good exercise while you're
What he's
working?
doing, I think he's trying to stretch.
Dr. Meka, you mentioned about having a stool while you're sitting, and so maybe that is one thing we can demand to our employers. Make sure everybody has a footstool right next to where we sit, because we do charting or we walking all the time.
So the footstool is probably not going to elevate your legs as much.
But at
there
least-
are stools that are like a stepper,
Yeah.
where you can like move it up and down. When you have your feet on it, it flips front and back. Those are actually pretty good.
Yeah.
They help you with the circulation.
Now, have you had anyone ask for a prescription for those? Because I was told
For a
that
stool?
if you, like the one that moves. I was told that that is something that you need for work, or I have heard.
I haven't had anybody.
No?
Well, I
Okay.
guess I'm going to start having them now.
Yeah. And especially, Annie, you are in the orthopedic
Correct. Yes.
department. Most of your people are always on their feet, right?
Correct. Everybody's standing on but the workstations. A lot of people actually prefer to stand. I have a standing desk that I can lower down to make a sitting, and then lift it up to be a standing desk as well.
Yeah, I think sitting too long may not be so great on the
yeah.
spine, so it helps with other things, but the calf contraction is what's important here. The leg elevation and the calf
So
contraction.
now we have to start moving our calf while we're sitting here.
Keep on moving those ankles. Pump it up. Foot
Pump it up.
You know, we have also like that foot pumps, right? Aside from the SCDs that we
Yes.
recommend, or we put on our patients while they're in bed and all that. So maybe nurses should have like some
Yes.
pumps. I'm just
Getting
being
closer.
funny here.
Yeah, and talking about foot pumps too, like not everybody can wear compression stockings, right?
Yes.
Because some patients, either their leg swelling is so bad, they have developed some lymphedema, which is a more advanced stage. It's because the venous insufficiency is not a single entity. It's a veno-lymphatic issue most of the time. And the leg can be too big, or they have arthritis in their hands and they cannot really put a compression
difficult,
stocking on.
yes.
Or they can have a big pannus. They may not be able to reach the leg so
Yes.
easy. There are several reasons why you can. And there are venous compression pumps for that, and that can be obtained with prescription.
Correct.
So that's something the patients can put on 2-3 times during the day, leave it on for 30 minutes to an hour, and that helps empty those veins, and that will help them a lot.
Yeah.
While Dr. Meka is talking about this, I think many nurses are now going to make some patent for those things that you're recommending.
Yeah, the pumps.
Actually, they do exist. There are like SCDs. It's
Yeah.
similar to the compression devices that you use for the patients in the hospital. Though there are some that can be bought for outpatient for patients that cannot do what Dr. Meka just said. It's difficult to pull up your compression socks for 20 to 30. Some have 30 to 40, and those are pretty tight, like the Job stockings. So
Yeah.
Yeah.
some patients have those compression devices that are leg pumps that they can use at home.
Yeah, it helps really for elderly people who do not have anybody to help them put stockings. There are donor devices, what we call, which can help put the stocking on, but sometimes it's very difficult to, and the pumps would be great for those patients.
Yep.
So,
Yeah.
Dr. Meka, is there such a thing like, supplements that can prevent one from getting varicose veins?
Well, now there is actually an FDA-approved drug. I can't say I have a lot of personal experience with this, but flavonoids have been proven to reduce the inflammation related to the veins. But I think this is after a patient has actually developed the veins. We are trying to minimize the symptoms of inflammation. So fresh fruits, berries, lots of water, citrus fruits and all, they have a lot of flavonoids, so theoretically they are going to improve the inflammation that can be common again with an advanced venous insufficiency. But are they the treatment? Are they going to completely cure? I don't think so. It's more of like a holistic approach to your venous problem, trying to kill each symptom with everything you can do to improve your heart health, improve your overall health.
Could varicose veins be inherited as well, Doc?
Yeah, they can be. Yeah.
Oh, poor
And
my
as I said, there
kids.
is no gene that has been identified to my knowledge, but they do run in the families.
Wow.
Yeah, my mother has it, so I have him. Although I can blame it on 3 kids and my profession too.
That's right.
So God knows what came first.
Well, Risa asked if there is a supplement that will help you prevent it. Are there supplements that would worsen it?
Not supplements that I can think would worsen it. Anything that causes inflammation in general can. But preventing, I wouldn't think there is anything as such as preventing. Minimizing the symptoms, as I said, the flavonoids may help, and lots of water, keeping the circulation going. And the biggest thing that can help patients who are overweight is losing weight helps tremendously. Symptomatically, it
Losing
helps
weight.
quite a bit, yeah.
Okay.
And pregnancy is a transient condition where the fetus is pushing from above or gravity is pulling from below. 60% of the time, the patients who developed varicose veins in pregnancy, they do get better. So, yeah. And particularly those that did wear compression stockings per the advice of their obstetrician, they do not have permanent sequelae of this.
Someone is asking, Ronald, my love, is asking, can he ask question? Yes, Ronald.
Absolutely.
Write down your question.
Send us the questions.
Send us the
Dr.
question.
Meka is here to answer your questions. I had a question, and of course, I just lost it. It
I'm
will come to
sorry.
me. That's
Yeah.
okay. No, it will come to me.
Yeah, so going back to those stages of varicose veins, doctor, it reminds me of my mom now, actually.
Oh.
Yeah, so I saw that stage 4.
Uh-huh.
So it's varicose eczema. That really looks how her feet, her legs, both legs. She used to be a teacher. Yeah. So I was like, oh, that is my mom's legs. So, but she's in the Philippines, and she just go in and out of the doctor's office. That's why I asked about the supplement, because they just give her this diasmin, hesperidine thing. And
Yeah.
they said, no, you cannot wear any more stockings because that will just worsen this.
Well, that's not true really. At any stage, the stockings can help as long as you have the right fitting stockings. So when patients come to our office, we do measure them, measure their calf sizes and ankle and thigh, and give them the right size stockings. And the one thing about stockings too, people tend to wear them when they remember during the day. After half day has gone by and they finally remember, I should have put my stockings on.
Before I got out of bed.
Yes. So the best time to wear would be before you get out of bed.
But you have to take a bath.
Well, you take a bath and go around doing your chores. If the kids are going to school, you have to run behind them, get them onto the school bus, do that.
Right.
And then take that 20-30 minutes of time in your life to elevate your legs after that. Elevate them so the heel is above the hip, let the blood drain back, let those veins decompress, and then put the stocking on. Now, if you put the stocking on when the swelling has already set up, then you're preventing more swelling from happening, but the stockings don't squeeze out what's already there.
Yes.
So what's there is there.
Correct.
It just prevents more from happening. So best way to do it is when the veins are empty. And if you have the habit of showering at night, I always tell my patients, have a pair of stockings next to your nightstand, put them on before you get out of bed, and then take it off when you go to bed at night. Or if you have an exercise regimen towards the end of the day where you go to the gym, you don't need to wear stockings during that time because you are going to be active. And gym too, a lot of people have varicose veins who go to the gym and quite healthy and muscular. That's the reason being people who tend to do weights, they can actually increase the venous pressure within the veins, and they're impeding the venous return sometimes with all the crunches, abdominal crunches. And I'm not saying you should not do it, but always follow it with a little bit of cardio, little bit of calf exercise of any kind, like treadmill or cardio machine, biking, and that's going to help you get the blood back to the heart.
Well, thank you. By the way, Ronald, my love, so how do you prevent varicose veins? I think he came in at the middle of our conversation. Ronald, unfortunately, your question doctor has answered a while ago. I hope you can go back to
Maybe view it again.
Yeah, review.
So quickly, Ronald, I would say few things that you can consider to prevent the varicose veins is if you are overweight, try to control your weight, be active. So exercising twice a day, at least 20 to 30 minutes of walks. If you're in a job where you have to sit or stand for a long time, you may want to do some foot pump activity where you're pushing on the gas kind of activity at the ankle and squeeze your calf muscle. That will help. And elevate your legs when you can. If you already started having some symptoms like pain in your calf, or you started noticing any varicose veins in the legs, then make sure to get some compression stockings, 20 to 30 millimeters of mercury strength.
And the safest way to treat varicose veins, as you have just mentioned.
So all the latest technology is pretty safe. We tailor the treatment plan based on their age, their other medical problems, if they are on any blood thinners, and to some extent, as I mentioned, it's also dictated by the insurance. Some insurances approve some kind of procedures, but all the procedures we have are safe, and the side effects of this procedure, some risk of developing blood clots in the deeper veins, and with the heat-induced ablation procedures, sometimes patients can have damage to the nerve branches and can have pain, but most of the time these nerves grow back and it's pretty safe.
Yes.
I have a quick question.
Yes.
So going back to what Rizza mentioned, her mom is experiencing stage 4 varicose veins. Of course, she's only being given oral advice not to use compression socks, but like you suggested, it's never too late to wear compression socks.
Yeah, never late, and then she needs to find a nice vascular specialist who can do an ultrasound and see how bad the veins are.
Yeah, and that's why if your mom is here, I would recommend your mom to go to Dr.
Dr. Meka when she comes.
Yes. Is she coming?
Not yet,
Not
because
yet.
it was like she's really having hard time
yeah.
on
With
her
the legs, yeah,
with
and
the
traveling
legs,
with
yeah.
those veins can also be a problem.
Yeah.
Because what happens in all these branches that are not really God-made, but it's pretty much a man-made thing, dilating all these side branches. The blood gets to be pretty stagnant in those veins. It's not moving very well, and people tend to get blood clots in those veins.
Yeah, somewhere
So-
they have to sit on the plane for
Yeah.
16
Exactly.
hours.
Right.
Yes.
So what if I have to, let's say, purchase something over the counter here and send it to my mom if she has to travel? Would the 15 to 20, I think 20 to 30, like you said, is prescription?
Yeah,
15 to
I
20?
would measure the calf, the largest calf diameter, and there are standard sizes. Online, you can look up and see
Okay.
which size would best fit her.
Okay.
So even if, you know, she has some ulcer going on,
Well, if
compression
that's late in
stockings still,
with ulcers,
advisable?
we recommend compression for sure. Not so much just talking, but a multi-layered compression wrap. And then they need to get the veins treated because the wraps can heal the ulcer 80% of the time they do, but the moment the wraps are off, the
Thank
skin is
you.
healed, they would come back.
And thank you, Ronald, my love. Thank you for
You're welcome.
giving
Thank
us
you,
your
Ronald, my love.
question.
Thank you, Ronald, my love, for asking the questions.
So
And,
yeah, once it's an ulcer, it's just late. We need to act on it immediately. And wraps, a lot of wound care centers do the compression wraps. They put the wrap on, it stays on for a week. It's a multi-layered compression, and they change weekly till the wound heals. And 80% of the patients heal with that, but the ulcer will recur if you don't wear stockings. And patients like those who developed ulcers, we recommend 30 to 40. And if they need to be seeing a vascular doctor to get their ultrasound done and see if there is anything they could do to shut down those veins that are damaged.
And is it advisable to give them sometimes antibiotics for the ulcer?
If it is
or
infected, yes, yeah, but the antibiotics in itself may not heal.
it will just keep on coming back?
It'll come, yeah, it's not going to heal. It'll probably prevent some infection, but it's going to be there. Compression is very important,
Very
and so is the
important.
vein treatments, yes.
Thank you, Dr.
Thank you so
Meka.
much, Dr.
Dr.
Meka,
Meka.
for this beautiful conversation. And I'm sure many of our audience would learn so much from this episode. So you need to experience Apex Vein and get an exceptional vein care. Contact 623-252-4495 and 602-535-0913 or apexvein&vascular.com. That's, you can go to her website. Such an amazing experience for me to see Dr. Meka at work and work on me. It's time to take care of our legs.
That's
Maybe
right.
one of these days I can wear proudly something to show my legs, but that's not my character from a young age. Good thing that I did not go wear a short even from a young age. So, there, Ronald, my love, what are the final stages of varicose veins? How do varicose veins develop? For my last question, please.
So the final stages are where you are developing a lot of inflammatory changes in your skin. Your skin is going to be thick and dark from bleeding happening within the skin and the fluid that's leaking causing a lot of skin damage. And beyond that is forming ulcers or bleeding veins. Preventing, like I mentioned, lifestyle changes, compression stockings are very, very important.
Can you show that one?
Oh my goodness, yeah. That is definitely
Yeah.
an ulcer that is trying to heal, and the skin changes are pretty classic for venous disease. The darkened, thickened skin with skin ulcerations is very, very classic for venous disease. So whoever these legs belong to need to see a vascular doctor right away.
Yeah. Javier, can you focus that
Camera.
Yeah.
There you go.
Wow.
On the phone.
That's the stage 4. The
Stage
last
four.
stage.
Yeah, last stage, yes.
Yeah, the last stage.
Yep.
And
This is my mom's.
unfortunately, in our
She needs to see it.
But it's better now.
Oh,
because,
good.
Yeah, because I
Yeah.
try to help
see,
her,
it's not only nurses who has the problem. Even teachers and anybody who are
That's why-
Always
in
on
a
their
long,
feet.
yeah,
That's why I
standing for a
ask
long
about
time.
if is it
Yeah.
genetic because
It
I'm
can
preparing
be.
myself.
No, you can prevent it.
Well, you have
Conversion stacking.
You have a
know how to
professional has that
prevent it
too
now.
because you're standing all day.
Yes.
Yeah, and the other profession I forgot to mention is hairdressers.
Yes.
Yeah, they are
That's true.
standing all day.
Yes.
Yeah, they I see a lot of patients like that.
Or flight attendants.
Flight attendants, yep.
Or those people in the construction.
Yep.
Anybody who's standing and using their legs will have
On
a
sales
need
also, like
to see a
grocery
vascular
cashiers.
surgeon.
Yep.
Yes.
Wow.
So anybody stockings, great time to wear stockings and do some foot exercises while you're standing.
You better let them know you need to wear compression
Yes.
socks.
Well, we really had a fun time talking to you, Dr. Meka. Time is running very fast.
That's true.
And we got so much covered. And amazing co-hosts, Annie and Rizza. I did not
you.
even
We had
have...
fun.
Yeah, and advance Merry Christmas and Happy New Year.
Oh, thank you.
Oh, thank you, Ronald, my love.
Ronald, my love.
Ronald, my love.
I'm sure Ronald, my love, is in the Philippines because it's the Philippines who is already celebrating
Wishing a Merry
Christmas.
Christmas. It's
in-
Burr months.
Yes. But as I mentioned, I really appreciate having you all with me today. And as part of BUHAY-BUHAY SA Amerika, we also have to show our upcoming events in the community. So before we close, let's have our upcoming events. Javier, are we ready for this upcoming events on September 27 from 2 to 10 p.m.? The International Women's Expo Convention will be held at Eduardo's Reception Hall. And for information, contact Jorge Garcia and Miss Irma Deil. And there's still opportunity for you to be a sponsor for this event. It's only $350 and you can get a table for this international women's entrepreneur and leaders in Arizona and connecting the world. Dr. Meka, maybe you can come join us in there too.
I would love to.
Yes, and this one, Rizza, can you
Okay,
read for us?
so on the 30th of September, attorney Loida Lewis will be here for a book signing. She is really a known
Filipino icon.
Filipino icon. Yeah, she is a mom.
And the wife
The wife of the
Mr. Reginald Lewis, a multi-billionaire.
multi-billionaire.
Yes.
Yeah.
And,
So-
and she's going to be here for a meet and greet and book signing. This is something that everybody should come to and meet
her.
Attorney Loida Nicholas Lewis.
Yeah, so
For
there will be-
reservation?
for reservation, you can call our PACA director, Miss Ethel Lazario, at 602-549-1011, or our PACA president, Edward Lago, at 602-545-7797.
Yes.
There will be a buffet dinner at Courtyard by Marriott Scottsdale Salt River.
Yes, and also for reservation for book, contact Rizza and MJ Manabat.
AJ.
AJ and Rizza, would you be Annie? Would you mind reading?
Sure, we have a consular outreach here in Phoenix on September 30th to October 1st. Please make sure to check the website of the Philippine Consulate, la.org, for requirements and also to schedule an appointment. It is not a walk-in. They will not accept walk-ins. Appointments are not required.
Thank you.
This will be done at the St.
Paul's.
Thank you.
Yeah.
Thank you.
Parish.
And on November 4 from 1 to 5 p.m., the Women's Federation for World Peace is hosting the Bridge of Peace. It's a transformative reconciliation from the inside out. It would be at the Hilton Garden Inn in Tempe. Just scan to register, and it's only $35 with refreshment and an amazing experience to bring peace to the world and a great networking event as well. And there is another one, A Smile in Your Heart by Ariel Rivera and Rupa May Quinto. It is another amazing concert brought by the Baisan Production this coming October 7, 2023 at 6 p.m. And tickets are all available. You can contact me, Rizza, or Ate Tess Bailon of BUHAY-BUHAY SA AMERIKA. We are trying to help support this concert, as well as some proceeds are Miss Jane Baisan is also helping the community through the proceeds of this amazing concert. So there's so much to say, and
Yeah.
another one you wanted to
Okay,
mention,
the
Rizza?
last but not the least, like on October 28th, the Philippine Nurses Association of Arizona is going to hold Community Health Fair Humanitarian Mission from 8 a.m. to 3 p.m. at West Valley International Church in Glendale. And there will be several services that we are going to offer, like A1C checking, cholesterol checking. We'll be also like distributing student packs, school supplies. We'll also be doing distributing glasses, sunglasses, as well as some produce. And if they want, if they want to volunteer, they can go to mypnaaz.org website. Oh, by the way, Maricopa County will also be giving flu shots and COVID shots.
And
Yeah,
that-
from 3 years old and above on this event.
Thank you so much, Rizza.
And I'm sorry, I just wanted to add, we are still in need of volunteers. So if you would like to volunteer, please check out the website of PNAAz at mypnaaz, PNAAZ.org, and look for events. We would love to see you there.
Yes, and if you are interested, be a member of the Women's Federation for World Peace or be a friend, you can go to www.wfwp.us for more information. And since we're talking about varicose vein health, thank you so much, Javier, for sharing that. I think, Dr. Meka, one of these days you can also promote having compression stockings in your when you go to these events.
That's right.
Some dentists gave away toothbrushes. I think for Christmas, our compression stocking would be a nice.
Definitely.
I was actually
But
like
it's not
thinking
cheap.
about like giving gifts. Usually we give gifts or exchange gifts with
We'll give
nurses.
compression
Yes.
So we'll
Yeah.
give
I think
compression,
compression
stockings this time. Yeah.
It's a must gift, not just
It actually, it's a gift that keeps on
on
giving.
giving.
That's
Yeah.
true. Yeah, absolutely.
Since Ronald, my love, has mentioned about Christmas, I think that would be a nice Christmas gift.
Yes.
Thank you so much again for joining. Do you have, Doc, please invite the audience to
last
come to
word.
your office.
Office.
Well, everybody, I don't want to say just come to my office and make me rich, but what I would like to say is I hope you got some take-home points from this talk. Take care of your legs, and spider veins are not just a cosmetic problem. They are probably the telltale signs of something bigger inside. So make the lifestyle changes, be active, wear your compression stockings. If you do have any symptoms that we talked about, despite all of this, then time to see a vascular specialist.
Yes, and don't forget, once again, Javier, show me again the address, and let's mention again Apex Vein and Vascular Institute at 4550 East Bell Road, Unit 280 in Phoenix, Arizona. And the number is 602-252-4495. Dr. Meka and her amazing husband is going to welcome you with open hands. Such a wonderful place to visit, and your legs will thank you after visiting.
Thank you, Rhia.
So that's from before and after.
Oh, wow.
That looks
You will have a beautiful. Yan ang tinatawag na wow legs. That's right.
Wow.
In the Philippines, we always say wow legs.
Legs.
So now we got wow, Dr. Meka. And thank you so much again for joining. This is Rhia Luz. Ms.
Thank you so much, Rhia, for having us here again at Buhay-Buhay sa Amerika. Thank you, Dr. Meka. We really have a lot of take home for this talk.
So,
And thank you, Rhia, for having Rizza and I and having us join this conversation with Dr. Meka. We
Yes.
learned a lot.
Yeah, thank
And
you
there's
so much.
there's a lot that we can bring back to our colleagues
Yes.
and families.
Yeah, thank you, Rhia, and thank you, Annie and Rizza. It was great talking to you guys, and thanks for all the questions.
Yes.
We can write a textbook
from
after
here,
this.
from here at Entre Mujeres Radio, from Buhay-Buhay sa Amerika, we thank you for joining and see you again soon. God bless you.
This was Buhay-Buhay sa Amerika. Join us again next time at entremujeresradio.net. Hanggang sa muli, mabuhay!